Welcome to the Public's Health, Alameda County's show for you, the public. I'm Dr. Muntu Davis, Deputy Health Officer for Emergency Preparedness. Dr. Iton was unable to be here today and asked me to substitute. Today we're talking about mental health, and our first guest today is Dr. Bernard Sklar, psychiatrist with Oakland Community Support Center. Dr. Sklar, welcome to the show.
Thank you.
Can you first start off talking about what behavioral health care services is?
Well, behavioral health care services is a branch of the Alameda County Health Department, and our duty is to take care of those people who have psychiatric illness, severe psychiatric illness, and those people who are unable to afford treatment in the private sector.
Okay. And what type of patients, just so we know, do you usually see?
At our clinic, we see primarily people who have a serious mental illness. The two mental illnesses that we most commonly see are schizophrenia and bipolar disorder, which used to be called manic depressive illness. Most of the people in our clinic have been in the hospital several times, and because of their mental illness are really not able to work or take care of themselves completely.
Okay. And are there other places that people can obtain mental health treatment or mental health care?
Well, most of the people with emotional problems are going to be less severe than the people that we treat in our clinic. And so there are lots of places where people who have milder difficulties can get treatment, either through their family doctor, through a psychiatrist they might see from their family doctor, or through other county services.
Okay. And is there a difference between the mental health treatment that they get in your facility, whether or not they have private insurance or public?
Well, hopefully there won't be any treatment. They'll be seeing doctors and social workers who are well trained, and they'll be getting medication that's appropriate for their needs, regardless of whether they're paying privately or receiving it through the county.
Okay, very good. Can you talk a little bit about, especially during this holiday time, the use of drugs and alcohol on the treatment of mental health illness?
Well, drugs and alcohol are almost never a good idea for mentally ill patients. One problem that a lot of mentally ill people have is a problem controlling their impulses, and most of the drugs that people will take, that is not medication, but drugs, will make it more difficult for people to control their impulses. The same is true with alcohol. So it's not a good idea to be drinking or taking drugs, especially at a time when they might be under emotional stress.
Yeah, that's a good comment. Now, can you comment a little bit on the difference between mental health illness and medical illness?
Well, it used to be thought that mental illness and physical illness were very different from each other. Physical illness was usually felt to be caused by a particular disease that could be identified and treated very, very carefully, whereas mental illness has been a mystery. People haven't known over the years whether it's a spiritual problem or a mystical problem or a religious problem. Nowadays, most psychiatrists feel that mental illness is caused by chemical imbalance in the brain. And it's our job to try to figure out which chemicals have gone awry in the brain and to supply other chemicals to try to fix that.
Okay. Now, there are no specific tests for determining the chemicals.
Unfortunately, there aren't. There are beginning to be tests which are complicated and expensive, but by and large, we have to make the diagnosis of mental illness based on what the doctor sees or what the patient tells the doctor or what relatives or friends may tell the doctor about the way the patient is behaving.
Okay. Speaking of family and friends, are there ways that mental health illness affects them differently from a medical illness that a person might have?
Well, they're both, of course, medical illness and mental illness both affect family, but mental illness being so somewhat mysterious causes a larger degree of frustration and anxiety in the family, I would think, than most medical illnesses, which are better understood as a clearer plan of treatment, and so the relatives should feel more satisfied that the right thing's being done for their loved one.
Okay. And are there any medical complications to serious mental illness?
Well, in fact, there are, not just to the illness itself, but to some of the medications that we're using nowadays. People with schizophrenia, which is the more serious kind of mental illness, tend to be overweight. They tend to have high blood pressure. They tend to have diabetes, and they tend to be very heavy cigarette smokers. And all of those conditions go along with schizophrenia. Unfortunately, in addition, some of the medicines that we're using to treat schizophrenia can make the weight problem and the blood pressure and the diabetes problem worse. So you rarely see a person who has only mental illness. He's probably got some sort of physical problem too.
So it would be important for someone with mental illness to also check with their primary care physician.
Right, and one of the things that we do a lot in our clinic is to make sure that every one of our patients who sees us for psychiatric illness also has a medical doctor and is getting regular medical checkups and treatment for whatever medical problems he or she might have.
Very good. It sounds like well-rounded care.
We try very hard to do that.
Very good. All right. Well, Dr. Sklar, thank you for being with us. Before we go on to our next guest, we'd like to take a look at some comments that people have had on the street, speaking of holiday mood as well as their coping mechanisms.
Holidays are stressful, but they're also fun. So it's and busy. I guess it's like any other thing. It's a mix of stress and getting together with family, and that's sometimes difficult. But overall, it's worth it in the end.
I'm happy and I ain't depressed. It's a nice feeling to make it through holidays. Yeah.
Me personally, I'm not really the holidays type.
I think it's more like happy and forgiving and, like charity feeling. It's like giving feeling. It's more like that.
Anxiety, too much anxiety. In-laws are coming in.
Fluttered. It's kind of a fun time. It's fun time. People seem to be nicer when they're out and about.
A lot of people seem to get depressed, and I work with the public in San Francisco, drive the bus actually, and it's, wow, I can see the people that's having a hard time and some people that really can't eat the way they want to, and it'd be kind of rough. So I'd be glad to see them come and go, so everybody be kind of even again, and the people that's really having a hard time don't stick out as much.
We walk about 5 miles a day.
I would say probably the best thing is at the end of the day just to sit down and relax with the newspaper, maybe a beer, and just kind of forget about all the hassles of the day. Or just zone out in front of the TV works too.
I don't know, try to get around as many family and friends as possible, you know what I'm saying, and other smiling faces.
And when it's raining, we go to the gym.
I am the really different that I feel really have a lot of time, more time on holiday. Since I don't have to do my routine every day, so I get more time.
Try to stay moderately even, keel all the way through.
They should do some volunteer work, so they be with the public. They can be around people that, maybe they feel the same way and they can get some stress off.
Yeah.
I think volunteer work, especially with kids, you can get something to do with kids, it'll bring you up a lot.
Yeah.
It helps. It calms us down. It lets us think things out and gets us, motivated to go throughout the day. Sometimes we have to walk twice a day because of the stress.
Yeah, to create a smile, you got to keep one, you know what I'm saying? So, and that seems to help pretty good.
It works out okay. I don't get too stressed personally. It's just a fun time. I enjoy it, It's just great. Yeah, no negatives. Okay, good for you.
Hello, my name is Anita Siegel, and I'm the Deputy Director of Alameda County Public Health Department. And like Dr. Davis, I'm substituting for Dr. Iton today. And I have as my guest Dean Chambers, who's a licensed clinical social worker from Behavioral Health Care. Welcome, Dean, and thank you for being on our program.
Thanks for having me. I appreciate it.
Dean, we heard a variety of emotions and comments from our viewers. And can you tell us what some of the common experiences people have around depression and other things during the holidays?
Yeah.
Some of the common emotions?
Yeah, thanks. Yeah, I think the roll-ins were great. I think the guests on there, they did a great job at explaining some of the things. You heard the relatives are coming. You heard about the shopping. You heard one woman saying she was fluttered. I also really liked the comments of a couple of the guys who talked about some interventions about, getting together with friends, getting together with family. I think, when we talk about holiday stress, I think one of the things that people refer to are expectations. I think, and also we live in a very consumer-oriented society today. I think there's a lot of expectations that you have to be happy all the time during the holiday seasons. The TV shows, and there's always a happy ending on TV. There's a lot of push to get out and spend money. But I think when we talk about the holiday blues, we're talking about some more of the moderate to mild types of depression and anxiety that people experience, about finances. When you talk about depression in moderate to mild levels, what are you talking about? Maybe some irritability. Anxiety and depression often go hand in hand. Sometimes anger and depression are kind of the same thing and can be interchangeable.
And what are the symptoms that we should be looking for if someone has the holiday blues? As a layperson, what should we be looking for?
Well, I think that guy one of the gentlemen who was interviewed had talked about working with the public, and he was seeing the irritability and talking about how hard it is for him to deal with. So irritability is definitely high on the list. Problems with sleeping, concentration on thoughts are consistent with depression. And I think the other thing with the holiday season is that you're faced with a lot of challenges because this time of year, we eat a lot. Sometimes we drink, and of course there's the shopping. And when people don't feel very well, those are all things that people want to engage in. And when you're not feeling well, you get this irritability again. You sometimes feel tired. Those kind of symptoms, you kind of have a way of interpreting things when you're depressed that maybe a person who wouldn't be depressed might interpret. For example, a lot of times when I work with depressed clients, they will say things like, well, I called somebody, they didn't call me back, maybe something's wrong. You don't have the ability to think logically that, well, maybe that person's on vacation, maybe they're busy, maybe they're stressed out. So I think a lot of times when you're on that spiral of anxiety and depression, you tend to have a negative interpretation of things.
And when should we go to a doctor or take medication, or should we, when we're experiencing some of the symptoms you've talked about?
I definitely think there's a place for medications in depression, and I definitely think that there are certain types of depression that are very extreme. Again, extensive loss of sleep, maybe that lasts for over 2 weeks, ruminating negative thoughts, especially when you're having thoughts of hurting yourself or hurting others. You shouldn't sit with those thoughts very long. You should pick up the phone, you should call someone, you should call a professional. There are helplines out there. I think we can get into that later, but I think those are the kind of serious thoughts that you're having. When you're really not able to sleep and you're not eating well, or sometimes when people get very depressed, they eat too much. So,
what about the holidays? If you've had a loss, you've lost a parent or a child during the year, and you're not going to have them around to celebrate the holidays, what should people do to not feel so depressed about that?
Yeah, that's a common problem. Anniversary dates of coming up. We often have good memories of our childhood. We may have bad memories, and sometimes either one can kind of affect how we feel. I think if you know you're prone to that, then hopefully you can do some planning around that issue. And I think, again, one of the gentlemen in the film had alluded to being around family that are positive. Obviously you don't want to be around family that might not be positive or it's going to stress you out. You don't want to be around other people who might be negative and who might be very depressed in the sense of, not really looking for any interventions for themselves. I liked his one idea about getting out to help people. Sometimes if you get out and help people, go to a soup kitchen and volunteer your services, working with children. I liked his idea about that. I think those are all great ideas. I think there's some light exercise often helps people. And I think that when you get depressed, a lot of clients I used to work with, they you get into, again, that a pattern of behavior that you often find difficult to break. I can remember working with a woman who she would leave work and she would go home, and this is typical with a lot of depression, and you have a certain thing that a routine that you get into. You come home, you sit on the couch, you pick up the remote, and actually by doing that consistently, you begin to set a mental pattern of, as soon as you sit on that couch, you become locked in a certain mentality that is often hard to get out of. So
do you recommend exercise or?
Exercise is great.
Physical activity?
Absolutely. And in this particular case, I can remember we had a discussion about bringing your gym shoes with you to work. And when you leave work, rather than go home, go to the beach or do your exercise before you get home. And I remember that intervention actually worked for her. So I think there are certain ways that you want to break the patterns of your behaviors. And of course, seeking out positive friends and, again, professionals if and when you really need to do that.
If someone like me is experiencing depression or stress and I don't want to call a doctor and I don't want to talk to a friend, is there something else I could do? Is there a number I can call?
Absolutely, and I brought my little magic card with me that I want to share with you, because these are definitely numbers that you don't want to get wrong. In Alameda County, we do have some services. First of all, I would like to suggest to people who have private insurance that you should take advantage of your private insurance. You should, talk with your doctor, and you can even call information, or if you're internet savvy, of course, you can go on the internet. And
what sites should you look for if you go on the internet?
I think you would look at, most private insurance companies have a department of psychiatry or psychologists or clinical social workers. Could also be very helpful. Or again, if you get lost in the shuffle, talk with your primary doctor, and they should be able to do a referral for you. If, in fact, you live in Alameda County and you're not fortunate enough to have private insurance, some people have SSI, some people are just on public assistance. There are services for you. We have a clinic that does psychological and psychiatric evaluations, which I'd like to share with you. It's in the Fruitvale district in Oakland, and that's Saucil Creek. The number there is 437-2364. Berkeley has some great services, and I'd like to add that we have very professional people at all of these sites, and they do very good evaluations. In Berkeley, we have the Grief Line. The number for that is 1-800-260-0094. And we also have a crisis line in Berkeley, and that's more for people who are feeling very, they might actually be feeling suicidal. So I would call that number at 849-2212.
Great.
And definitely, again, check with your private provider. Red Cross, Kaiser, Blue Cross, all private providers usually have some sort of mental health services for people.
Okay, very good. What about eating? You have any recommendations for eating? I mean, people seem to celebrate a lot by eating.
Absolutely. As I think I mentioned, one of the things about this time of the year is the drinking, eating, and shopping. Therapists refer to those type of behaviors at times as mood-altering substances. You typically wouldn't think of shopping as a mood-altering, well, I wouldn't say substance, but behavior. I wouldn't think of shopping and again, eating as being those type of things, but obviously they are. So I think you want to eat healthy. You can have snacks if you're going somewhere. You may want to snack before you go there. You want to you want to exercise if you can. And you just want to follow a lot of the basic common sense things that can manage depression very well. But you have to break the pattern, and you have to move in that direction. And once you take the first step, it's usually easy to kind of continue to take the steps.
Well, talking about healthy eating is a great segue to our next segment, because we have staff from our nutrition services that is going to tell us a little bit about healthy eating and how to stay on track. Dean, thank you very much for being on our show.
Thanks for having me.
And I'm sure our viewers will enjoy everything that you told them today about staying mentally healthy during the holidays.
Thank you very much. It's a pleasure to be here.
Well, it's that time of year again when we all talk about not overeating, and we do overeat, and then we make New Year's resolutions to go to the Y and take off the extra pounds. But there are things that we can do to prepare our favorite foods in a healthy way.
Our Nutrition Services program of Alameda County is very concerned about making Alameda County a healthier community by improving our nutritional habits and increasing our physical activity. From Nutrition Services we have today Darlene Fujii and Pamela Aziz. Both are registered dietitians who are very dedicated to making our community healthier. Welcome to the program.
Thank you. Thank you.
So let me begin by asking a question that I may already know the answer to. How bad is the obesity problem in Alameda County?
Well, Alameda County isn't doing much better than California and the rest of the nation. And in some studies that have been done in Alameda County within the last 2 years, we found that over half, 51% of the adults in Alameda County are overweight. And over a third, or 35% of the school children in Alameda County are overweight. And so it's more than just us being concerned about weight and waistlines. You know, what the real concern is that being overweight elevates your risk for just about every chronic disease that's killing us. Heart disease, stroke, cancer, diabetes. So that's the real concern.
So, in order for us to eat our favorite foods, you're going to show us how to prepare one of our favorite foods in a healthy way.
Yes.
What are you preparing?
Well, today I'll be preparing apple glazed sweet potatoes.
Okay.
It's a healthier version of candied yams.
And the way that you prepare this, what makes it healthier than the way that people normally prepare it?
Well, if you think, have you ever had candied yams?
Yeah.
Well, if you've had that dish, if you prepared that dish before, you know that there's butter, there's a lot of syrup, and there's brown sugar, and all of those things add extra calories to something that is already healthy in itself. The sweet potato is a very healthy vegetable in itself. So this recipe that I'm preparing today just calls for the sweet potato, apple juice, and cinnamon. That's it, just 3 ingredients.
That sounds simple, but making it healthier, does it change the taste?
Well, I want you to see for yourself. But let me show you first how to prepare the apple glazed sweet potatoes. First of all, you want to take 2 peeled sweet potatoes and you want to chop them up. I'm just going to put my glove on here while I chop the sweet potato up. And you want to slice them relatively thin. This dish takes about 15 to 20 minutes to prepare. Once you've sliced the sweet potatoes, 2 sweet potatoes, you need 2.5 cups of apple juice and a teaspoon of cinnamon. And takes about, as I said, 15 to 20 minutes to prepare. But what is special about this particular recipe is that the apple juice actually forms a nice glaze, giving you the impression, you know, candied yams are pretty glazed, and you know, you have that nice syrupy glaze with it. But with the apple juice, after you cook it a while, the apple juice actually forms a glaze. So what you're going to do is put all these ingredients together, and we have an electric skillet here that we're going to prepare this dish in. Here's the cinnamon. Just put it all in there together. Use a spoon to kind of stir it up a little bit there. Put the top on it, just let it boil. 15 to 20 minutes. That's all you need to do.
One of the problems I have during the holidays is I love sweets, and I always eat too many. Do you have some tips of how I might substitute sweets for healthy food?
There are some things that you can do to substitute in recipes. For example, for the fat in a recipe, you know, instead of the butter or the oil, you can use applesauce or a pureed fruit in the same amount that the recipe calls for the fat in the recipe. You can reduce the sugar in a recipe and just boost the spices like cardamom or anise or cinnamon or the vanilla, and that gives the impression of more sweetness. At the same time, you can reduce the amount of sugar. And then if a recipe calls for eggs, instead of 1 whole egg, you can use 2 egg whites, and that reduces the amount of fat and calories both in the recipe. So without altering taste very much.
Oh, great.
So
why don't we have some apple glazed sweet potatoes that we have prepared, and you let the audience know how good it actually is.
Okay, sounds like a deal.
Serve it up.
Okay.
Oh, they look nice.
Yeah, see how nice that apple juice forms the glaze?
And you can really smell the cinnamon.
Yeah.
So instead of the sugar, use the apple juice, and that gives it the sweetness and gives it also the glaze appearance.
Right. And then, of course, you have the cinnamon as well.
Mm-hmm.
As Darlene was saying, to give it that impression that it's sweet. And
That's good.
It's delicious.
You can taste the cinnamon in there too.
Yeah,
very good.
yeah.
Very good. Well, thank you very much for sharing these tips with us. If our viewers want to know more about other healthy tips, they can call Alameda County Nutrition Services at?
Yes, at 595-6454.
And they can get copies of this lovely book, Secrets to Healthy Living.
And this recipe is in that book along with many other healthy recipes for some traditional foods and some new kinds of recipes that people might want to try.
Thank you. Thank you very much.
You're welcome.